Which brings me to this year's budget debate. And the budget that passed the House of Representatives contained a very radical change in the way this nation would provide health care for our seniors. Medicare was established in 1965 because private insurance companies weren't anxious to insure older people. Why? Private insurance companies make money by insuring people who don't make claims. As you get older, you make more and more health claims. Therefore, you're not as interesting from the point of view of profit to the private insurance companies. That's why we created Medicare in 1965. The budget that passed the House of Representatives would change that plan that you now have government-guaranteed benefits to instead give you a voucher, a money voucher that would be taken to private insurance companies to buy private insurance, no longer government insurance. And yes, it may not affect you directly because of the age cutoff that they use, but it will affect our seniors because it's a change in philosophy, a dramatic change in philosophy. It would make our seniors subject to the whims of private insurance companies. And the bean counters, those who tell us what impact this will have, tell us that when this would be fully implemented, our seniors would pay twice as much as they currently pay in out-of-pocket costs. So it would double your out-of-pocket costs, which is something that I can tell you I'm going to do everything I can to make sure it does not happen. And it won't happen because we're going to fight this. And I can tell you, even though it passed the House, and you've got to be alerted about this, we're going to make sure that this plan does not pass the United States Senate. We find it very damaging. I want to mention one other part of the House-passed budget that I would hope you would also join me in opposing. And that is what it does with the Medicaid program. Now, the Medicaid program is not Medicare, so let's make it clear. But the Medicaid program is what a lot of seniors use to cover long-term care needs, nursing care. It also is very important for families because that's what children get a lot of their coverage, low-income families. So it's a very important program. And it's part of our commitment to tell all Americans that they have access to affordable care. Health care is a right. It's a privilege. It's a right, not a privilege. Part of our commitment to make sure that becomes real. So if the budget that passed the House were to become real, Medicaid, which is a partnership between the federal government and the state governments today, would be changed into what is known as a block grant, putting the full burden on the states. And with their current fiscal situation, there is no way that they could maintain the commitment to our seniors and our families. And that's another program that I can assure you that your senator is going to do everything in our power to block that block grant effort on Medicaid that's in the House-passed budget.